The number of vaping-related deaths in the U.S. has now reached 21. Michigan and Pennsylvania both reported deaths from lung disease that could be tied to vaping today. It's the first possible vaping-related death for both states. The CDC is reporting at least 1,080 probable cases of lung injury associated with e-cigarettes. Health officials are now warning users to immediately stop vaping any illegally purchased products. The U.S. will be able to keep its measles elimination status. The country was at risk of losing it after the worst outbreak in decades. The CDC says more than 1,200 cases were reported in 31 states. The majority of the patients were unvaccinated children. The outbreak started in New York in October of 2018. The U.S. declared the highly infectious disease to be eliminated back in 2000, meaning there was no continuous transmission for a year. Surgeons do a lot of planning before performing an operation, and now some new technology at a hospital in Kentucky is making it a lot easier. Mara Ansari takes us there.
Inside Norton Children's Hospital, in the operating room, you'll find typical things like lights and a bed. There's also something here that a lot of people play with.
It's just a standard controller, and one joystick will move you up and down and left and right, and the other one will move you forward and back and rotate. And so I can hand this to a kid, and 9 times out of 10, they know exactly what to do.
This is new technology called surgical theater. With virtual reality goggles and controllers, you can actually see and navigate inside a child's skull and brain. It allows doctors, patients, and their families understand things like tumors and lesions through a 3D view.
This is a patient who has a lesion in the bone behind his eye. So that's what this green blob is here.
It's a way to let patients and families understand what we're talking about, which isn't necessarily straightforward a lot of times.
Two-dimensional scans like an MRI and CT have been used for decades to diagnose and treat neurological conditions. Surgical theater takes those 2D images and combines them to create a 360-degree color and virtual model of the skull, the brain, and other important anatomic details. It gives surgeons a focus.
You just simply don't have to look at 30 two-dimensional images to get a sense of the bone lesion. You can look here and just see in green where the bony lesion is in respect to the brain.
It gives doctors a chance to practice a procedure before they enter the OR, helps define issues, and it gives their patients and families a chance to understand a condition from the inside out by giving them things they're familiar with.
You put the goggles on a kid and you give them the joystick, they just dig it. They dig it, and their ability to access it there are no barriers.